H syndrome is a rare autosomal recessive genetic disorder caused by mutations in the SLC29A3 gene, which encodes a nucleoside transporter protein. It is characterized by a combination of systemic clinical features, many of which involve inflammatory and fibrotic processes. The H in H syndrome stands for the constellation of common features often seen in affected individuals. Key clinical features: 1. Hyperpigmentation, localized or diffuse, often associated with indurated skin. 2. Hypertrichosis, excessive hair growth, particularly over hyperpigmented areas. 3. Hearing loss, sensorineural in nature. 4. Heart abnormalities, cardiomyopathy or other structural defects. 5. Hepatosplenomegaly, enlarged liver and spleen. 6. Hypogonadism, incomplete development of secondary sexual characteristics. 7. Short stature, growth delay is commonly observed. 8. Other features: diabetes mellitus, arthritis, and systemic inflammation. Pathophysiology: the SLC29A3 gene is involved in nucleoside metabolism and cellular repair processes. Mutations lead to dysfunction in these pathways, contributing to inflammation, fibrosis, and multisystem involvement. Diagnosis: clinical assessment, based on characteristic features. Genetic testing: confirmatory diagnosis via identification of mutations in the SLC29A3 gene. Imaging and biopsy may show fibrosis in affected organs. Management: symptomatic treatment address individual symptoms, e.g., hearing aids for hearing loss, hormone replacement for hypogonadism. Anti-inflammatory therapy to manage systemic inflammation and arthritis. Supportive care includes physical therapy and regular monitoring of organ function. Prognosis: while the disorder is progressive and affects multiple organ systems, the severity and course vary among individuals. Early diagnosis and management can improve quality of life. If you'd like, I can elaborate on specific aspects or discuss case reports related to H syndrome. Case reports on H syndrome. 1. Family clustering and SLC29A3 mutations. Case description: a study reported multiple members of consanguineous families exhibiting classical features of H syndrome. Clinical signs included hyperpigmentation, short stature, sensorineural hearing loss, joint contractures, and hypertrichosis over indurated skin. Genetic analysis confirmed a homozygous mutation in the SLC29A3 gene. Learning points: this highlights the autosomal recessive nature of the disease and the importance of family screening in consanguineous populations. 2. H syndrome with juvenile onset diabetes mellitus. Case description: a child presented with hyperpigmentation, joint stiffness, and diabetes mellitus diagnosed in early adolescence. Examination revealed hypertrichosis over the lower limbs, joint contractures, and hepatosplenomegaly. Skin biopsy showed dermal fibrosis and lymphocytic infiltration. Genetic analysis confirmed the SLC29A3 mutation. Management: the patient was managed with insulin therapy, anti-inflammatory medications, and physical therapy. Learning points: juvenile diabetes is an underreported feature and may be due to chronic systemic inflammation. 3. H syndrome mimicking systemic sclerosis. Case description: a 14-year-old girl was misdiagnosed with systemic sclerosis due to skin thickening, joint contractures, and organ fibrosis. She also exhibited hyperpigmentation and hearing loss, which were atypical for scleroderma. Genetic testing revealed a pathogenic SLC29A3 mutation, confirming H syndrome. Learning points: this case emphasizes the importance of recognizing distinguishing features, e.g., hypertrichosis, hearing loss, and using genetic testing to differentiate H syndrome from other fibrotic disorders. 4. Variable phenotypic expression in siblings. Case description: two siblings with confirmed SLC29A3 mutations presented differently. The elder sibling had severe hepatosplenomegaly, cardiomyopathy, and diabetes mellitus. The younger sibling exhibited milder symptoms with only skin hyperpigmentation and short stature. Learning points: this case highlights the variability in phenotypic expression despite identical genetic mutations. 5. Arthritis as a prominent feature. Case description: a young male presented with recurrent joint pain, arthritis, and skin hyperpigmentation. He was initially treated for juvenile idiopathic arthritis JIA, but later found to have systemic involvement, including hearing loss and short stature. Genetic testing confirmed H syndrome. Management. Anti-inflammatory therapy led to significant relief of arthritis symptoms. Learning points. Arthritis may be an early and misleading feature of H syndrome. These cases underscore the multisystemic nature of H syndrome and the challenges in diagnosis. Let me know if you want more details or references. H syndrome is an extremely rare disorder, with fewer than 200 cases reported globally in the medical literature as of now. Most cases come from consanguineous families in regions where interfamily marriage is more common, such as the Middle East, North Africa, and parts of Asia. However, isolated cases have also been reported in Europe and North America. Reasons for low reported cases. 1. Rarity. The condition is caused by mutations in the SLC29A3 gene, which are uncommon. 2. Misdiagnosis. Its clinical features overlap with other disorders, such as systemic sclerosis, juvenile idiopathic arthritis, or storage diseases, leading to underdiagnosis. 3. Limited awareness. Many physicians are unaware of the syndrome due to its rarity, particularly in non-consanguineous populations. 4. Incomplete genetic screening. In some settings, access to advanced genetic testing is limited. If you'd like, I can provide additional information about specific regions or discuss trends in reported cases over time. As of recent reports, fewer than 200 cases of H syndrome have been documented globally. The majority of cases are concentrated in consanguineous families, particularly in the Middle East and North Africa. But cases have also been. A specific report highlighted 5 new cases in the United States, including patients of both Middle Eastern and Northern European descent, showcasing some novel genetic mutations and clinical features. 12th source. Regional trends. Middle East and North Africa. The majority of cases originate here due to higher rates of consanguinity, which increases the prevalence of autosomal recessive disorders like H syndrome. North America and Europe. Reports include a small number of cases with both classic and unique manifestations. Access to advanced genetic testing has facilitated diagnosis in these regions. 12th, 13th source. Diagnostic challenges. The syndrome is often misdiagnosed due to its phenotypic overlap with conditions like systemic sclerosis, autoimmune diseases, or storage disorders. Increasing awareness and genetic testing availability are crucial for identifying more cases. 12th source. If you're interested in recent case studies or specific clinical findings, let me know. Recent case studies on H syndrome provide insight into its presentation, diagnosis, and management. 1. 2 case reports with tocilizumab therapy, 2023. These cases highlighted autoinflammatory manifestations and lymphadenopathy in patients with H syndrome. Treatment with tocilizumab, an IL-6 receptor blocker, showed improvements in systemic inflammation, hyperpigmentation, arthritis, and organ infiltration, although limitations in resolving certain complications like atrial infiltration were noted. This supports IL-6 blockade as a potential therapy for systemic inflammation associated with H syndrome. 2. Case from India, 2022. A young woman with systemic features such as retroperitoneal fibrosis, short stature, hearing loss, and other typical H syndrome manifestations was treated with steroids and methotrexate. Genetic analysis confirmed mutations in the SLC29A3 gene. The case emphasized the need for recognizing rheumatological mimics in diagnosing rare syndromes. 22. 3. 5 pediatric cases in the U.S. 2023. These cases introduced novel features like selective IgG SOS deficiency and autoimmune hepatitis. Tocilizumab was effective in managing systemic inflammation in some patients, while others responded to combinations of immunosuppressants. The study emphasized the importance of genetic testing for accurate diagnosis and optimizing treatment strategies. 21. These reports underscore the variability in H syndrome presentations and highlight the emerging role of biologics in its treatment. For further details, the studies are accessible through their respective journals and platforms. The SLC29A3 gene encodes a protein called the equilibrative nucleoside transporter 3, ENT-STA, which is part of the solute carrier family. This transporter protein plays a crucial role in cellular metabolism by regulating the uptake and intracellular distribution of nucleosides, building blocks of DNA and RNA. It is primarily localized in lysosomes and mitochondria and contributes to maintaining cellular nucleotide pools and nucleoside recycling. Role in disease. Mutations in the SLC29A3 gene are associated with a group of rare autosomal recessive disorders, collectively termed SLC29A3 spectrum disorders, which include 1. H syndrome, characterized by hyperpigmentation, hypertrichosis, hearing loss, and systemic inflammation. 2. Faisalabad histiocytosis, a condition with recurrent fever, lymphadenopathy, and histiocytic infiltration. 3. Pigmented hypertrichotic dermatosis with insulin-dependent diabetes mellitus. Features overlap with H syndrome. 4. Familial Rosai-Dorfman disease, a rare disorder marked by sinus histiocytosis and lymphadenopathy. Function of EN3. The ENT3 protein is crucial for transporting nucleosides across lysosomal and mitochondrial membranes, supporting cellular energy production and DNA repair processes, regulating immune responses, and preventing uncontrolled inflammation. Impact of mutations. Mutations in SLC29A3 disrupt EN3 function, leading to accumulation of inflammatory cells, histiocytes, tissue fibrosis, and systemic inflammatory responses. Multisystem involvement, including skin, joints, endocrine glands, and hearing. Genetic testing and research. Identification of mutations in the SLC29A3 gene is key for diagnosing H syndrome and related disorders. Ongoing research aims to explore targeted therapies, such as anti-inflammatory agents and gene therapy, to manage or correct the effects of these mutations.